Hi everyone. Our proposed research will look to analyze the effects of red and processed meat consumption versus a vegetarian diet on cardiovascular disease risk. Starting off with a little bit of background, cardiovascular disease is the number one leading cause of death both in the United States and worldwide. There are multiple behavioral risk factors that contribute to cardiovascular disease. These risk factors include diet, exercise, tobacco use, and alcohol abuse. Their effects can be observed through high blood pressure, elevated blood glucose, dyslipidemia, and overweight and obesity. Many behavioral strategies have been identified to combat these risk factors. These include eating healthy, engaging in regular physical activity, getting sufficient amounts of sleep, cessation of smoking, and regular visits with a primary care physician. As previously mentioned, an unhealthy diet has been confirmed as a behavioral risk factor for the development of cardiovascular disease. Diets high in red and processed meat are of particular concern due to their sodium and saturated fat contents. On the other hand, it has been proposed that a vegetarian diet reduces the risk of cardiovascular disease by improving factors including blood pressure, cholesterol levels, overweight and obesity, and the incidence of type 2 diabetes.
When conducting a literature review on this topic, multiple studies found associations between a high intake of red and processed meat and higher risk of CVD. Many studies also found the vegetarian diets were associated with a lower risk of CVD. However, the reasoning for these outcomes are uncertain, as no causal relationship has been established, but it has been proposed that diet quality may be a factor. For example, a study found that lacto-ovo vegetarians had the highest diet quality and lowest incidences of CVD. The research question that will be answered through this trial is the risk of developing cardiovascular disease higher in populations consuming high amounts of red and processed meat than in populations following a vegetarian diet? To answer this research question and work towards establishing a causal relationship between red meat and processed meat intake and cardiovascular disease in comparison to a lacto-ovo vegetarian diet, we chose to propose a quantitative study design, specifically a pilot non-randomized controlled trial. A pilot study was chosen due to concerns for the feasibility of the study. The study will contain a total of 50 participants. Inclusion criteria to be considered for the study include being 18 years or older, consuming red or processed meat regularly, specifically 1 3-ounce serving more than 3 times per week, and a total cholesterol of greater than 200. Additionally, for the intervention group, participants will need to be willing to adopt a lacto-ovo vegetarian diet. Exclusion criteria includes any previous cardiovascular events, severe renal impairment, conditions associated with risk of bleeding, abnormal liver function, substance abuse, and possibility of pregnancy. Once selected, 25 participants will be placed into the intervention group and 25 will be placed into the control group. Individuals in the control group will continue their normal diet with no modifications, and participants in the intervention group will be asked to follow a strict lacto-ovo vegetarian diet. To help with adherence to this lifestyle change, pre-made meals and healthy recipes will be provided to this group. To assess for changes in cardiovascular disease risk, metabolic biomarkers, blood pressure, anthropometric data, and EAS CVD scores will be assessed at baseline, at 3 months, and at the end of the 6-month period. A food frequency questionnaire will be administered at baseline, at 3 months, and at the end of the 6-month period to assess for dietary intake and dietary quality. And a mini food frequency questionnaire will be given weekly to assess individuals' adherence to their diets.
Of the variables within this study, the metabolic biomarkers include total cholesterol, low-density lipoprotein or LDL cholesterol, high-density lipoprotein or HDL cholesterol, triglycerides, and non-HDL cholesterol, which are all measured by the lipid panel. The BMI and abdominal waist-to-height ratio are measured by the participant's weight, height, and waist circumference. The cardiovascular disease risk score is calculated from the participant's age, sex, race, and fasting standard lipid panel. The participant's blood pressure is measured with a sphygmomanometer, and their dietary intake is tracked with the use of a food frequency questionnaire. These variables are measured or collected prior to, in the middle of, and after the intervention has been implemented. We expect for the study's intervention to have an effect on the metabolic biomarkers, weight trends, blood pressure, and for any changes in the participant's long-term CVD risk to be dependent on the adherence to the intervention. Required resources of the study include funding from a grant, utilizing a primary care facility to aid with recruitment and the use of their facility and healthcare professionals. This will provide a confidential environment and will need to be equipped with 3 rooms, a sphygmomanometer, stadiometer, scale, tape measure, and blood collection supplies for data collection. Furthermore, a catering service and a registered dietitian will be needed for the meal plans and participants' consultation. An electronic database for safe and secure storage of the participants' informed consent and collected data, including the aforementioned variables and measurements, will also be required. Given the researchers' participation in data collection and support from the primary care facility to utilize the space for lab and data collection, the researchers will be able to remain within the budget allocated by the grant. The participants' informed consent will include an overview of the study, its background, methodology, and data collection, the confidentiality of this information, potential risks and benefits, including the risk of continuing the diet high in red meat and correlated risk of cardiovascular disease, the fact that the participants' enrollment in the study is voluntary, and contact information for resources that are available to the participants throughout the study.
Discussion. Due to the nature of this study, there were multiple possible limitations. Of ethical concern is the use of a control group. It would not be ethical to request that the control group continue consuming high amounts of red and processed meats due to their proven negative effects on cardiovascular disease risk. To address this concern, the control group will not receive any dietary requests. This may lead to diet changes within the control group. The duration of the study is relatively short in regard to the possibility of changes in cardiovascular disease risk factors. There is also potential for selection bias to occur in any non-randomized study such as this one. Lack of control over confounding variables such as exercise, sleep, and socioeconomic status may also have undesired effects on the results. The sample population, as well as the inclusion and exclusion criteria of the study, may limit the generalizability of the results. Lastly, in comparison to a randomized control trial design, the non-randomization of this study decreases its validity. There are many opportunities for future research to take a further look into this topic. Firstly, given that our design is a pilot study, a more comprehensive study may benefit more from a quasi-experimental pre-test, post-test design in which all the participants will receive the intervention. This may improve the integrity of the methodology. Additionally, the majority of prior research done on this subject has analyzed correlation rather than causation. As mentioned above, a quasi-experimental design may be ideal when trying to establish causality. Lastly, future research should account for increased generalizability by including additional populations, such as those with past cardiovascular events, having greater control over confounding variables, and involving a larger sample and longer duration.